So the one was like wishing the phone.
Yes, we start. Good evening, members of the KMPDU Secretary Nyanza branch. As you are aware, we served in Nyamira County a strike notice, actually lapsing on 25th September. Today we are here, we met the doctors over the 3 key issues we raised in our demand. One is to do with the promotions and designations. We have had doctors, actually Nyamira County, for us is a very worst employer, whereby they don't look into the welfare of our members with regards to labor practices. So we have had doctors who have stagnated for so long, some as even more than 10 years. They have never been promoted. Most have never been designated to correct job groups. So that's one of the demands we gave the county government of Nyamira to look into, and so far they have not addressed. Another issue, we have about 8 doctors who were employed in early 2021. They were employed on probational terms, and so far they have not been confirmed. And yet we understand, as per the law, employees need to be on probation for just 6 months. Also, the other issue, we have the county government had issued a directive to all banks and other creditors, such that they don't issue loans to the workers, and the doctors are part of the workers. So one of the demands, the 3 demands, is that they have to withdraw that directive so that our members can access the loans. Thank you.
Of the 4th estate. As KMPDU, our main objective is to make sure that the citizenry access healthcare and quality healthcare. One of the reasons we are very perturbed by Nyamira County is because we are seeing a consistently deteriorating level of healthcare. One, we already have healthcare providers who are complaining about the level of financing of our health facilities. When I say financing, I mean we do not have medication in our facilities. We do not have necessary equipment to carry out our daily activities. And the consequence is that the citizenry is suffering from substandard provision of healthcare. And usually when this happens, the complaints usually goes to the healthcare provider, who at that moment is not well equipped. The second thing we are worried about is the level of morale in the healthcare workers. One, when the healthcare worker is not paid on time, the morale is low. If the healthcare worker is not employed on their rightful terms, the morale is low. Finally, ladies and gentlemen, we do not wish to leave our people of Nyamira to suffer in the hands of a government that has decided to ignore her people. We are with the people, and we are praying and hoping that the people of Nyamira County will come and join us in demanding for the right to healthcare, which is among the Bill of Rights. Thank you.
You can see the way I am today. We did not plan to do a press statement, but this is happening because of the resounding frustration and disillusionment that the doctors of Nyamira are having. And this is happening because the county government has deliberately decided to disobey the court orders that were given in 2021 regarding the state of healthcare. And the court order was very clear. The doctors should be promoted to the right job groups. It was very clear that there's a big shortage of doctors in Nyamira County, and therefore the county ought to employ the medical officers, the pharmacists and the dentists, and also other healthcare workers. It was also very clear that there's need to have career progression. I mean, doctors need to go for postgraduate studies. But therefore, this time is coming when the doctors who are in the hospitals, the consultants, and all these other cadres are frustrated. They're not able to actually serve the patients as expected. They don't have the drugs, they don't have the reagents, they don't have the equipment, and they are overburdened to the extent that we have doctors who have reported that even when they are sick, they have to come to the hospitals to offer services. And therefore today, the doctors are calling out on the public, calling out on the county government that the right to health care is well enshrined in Article 43 of the Constitution. And the right to actually obey these court orders is also given to all the Kenyans. Therefore, these doctors are given a notice of strike to the county government that within 21 days, which expires on 25th of this month of September, the county ought to have actually sorted out these issues. Failure to which, it is the county which actually will be on strike. Because normally the law gives us 7 days to give the notice, but we gave 21 days. 21 days was to give room for engagement. 21 days is to give room for the county actually to stock the hospitals with all the equipment and the drugs that are needed. 21 days is enough for the county actually to promote the consultants who are actually being paid in the same level as interns. 21 days is enough for the county to actually advertise and employ doctors for this county. And therefore we are open for the negotiation and discussions, but failure to which on 25th, there will be no doctors working in this county of Nyamira. And when I say doctors, it means all the consultants, it means all the medical practitioners, it means all the pharmacists and all the dentists who are here, including all the interns, because the issues and the frustration that are affecting them are resounding across the county. And we are seeing, ideally, that almost in every county that we go to, we were the other week in Embu, the other time we were in Nakuru County, we were also in Meru, and it's a clear frustrations that the county governments are deliberately not ready to actually support the health workforce. They're not ready to actually support and buy the equipment that are necessary for the hospitals. And therefore, it is not right and not justice for the doctors to continue being in the hospitals when the only single role they have is to certify that a patient has died. It is not right for doctors to continue being in the hospitals when they know that a patient who has come with a condition that can be treated is not treated because there are no drugs, there are no emergency drugs, or there are no equipment to support them. And therefore, we are saying no, and we are insisting that the rights of Kenyans to access healthcare must be the first right to be observed. Thank you.